I want to introduce myself. My name is Christina. I am the medical social worker for the CAS program at OSU Wexner Medical Center. I'll tell you a little bit about my background. I've been in the field for almost, I don't want to say this number out loud, 20 years. My background is in, I was a vocational specialist. And I recently joined the CAS program 2 years ago as a medical social worker. And like I said, my background is in working in vocational work, but also worked very closely with Delaware and Franklin County Board of Developmental Disabilities.
And my name is Brittany. I'm the CAS RN Care Coordinator, and I'm kind of the side character today to the main character, Christina, but I'm here to support her just like I support the patients in the CAS program.
And well, she doesn't have a microphone, but this is Rachel. It's okay.
Hi, my name is Rachel Menson. I am the psychotherapist for the CAS program, and I come from Delaware County originally, and I have been working in the field of disabilities since 2009 in various capacities. I was a behavior specialist before this, and now I'm doing counseling.
All right. Is it okay? Okay. I kind of want to read the room a little bit, or where are most individuals coming from here are from a county board of sorts. Is that correct? Okay. Won't hurt my feelings on this next question, but how many, raise a hand, have heard of CAS prior to this? Okay. All right. Well, that's what we're here today, is to kind of talk about what CAS is. It is, obviously more than an acronym. And we're going to talk about specifically how did CAS come to be, and what it is, what services we provide, what makes CAS unique and exceptional in my opinion, and just overall what OSU is doing to bridge the gap from pediatric care to adult care for individuals with autism. All right, let's go ahead and get started. So CAS is a primary care clinic. We are located, are we switching over? There we go, we can get past that. We are located in 4 different outpatient centers through OSU. We are located, our main office is in Hilliard. We have an office in New Albany, Lewis Center, and Grandview. That's our most recent office. I'm trying to think. We will soon be adding a different location coming up, so that'll be nice, and we will continue to grow. But specifically, CAS was, we can go to the next slide. Okay, so why was CAS needed? Obviously, the bridge from teenage life to adult life is complicated enough. So you factor in the barriers that individuals face, specifically coming from pediatric care where you maybe have a little bit more supports to adult care, that wasn't there. So autism, in fact, it impacts 2.2% of adults in the US are actually diagnosed on the spectrum. So with that, that number is going to continue to grow. CAS came to be because we saw a need. Sorry, I'm going to go ahead and do any of you guys recognize this face here, up here? That is Marcy. I have it, okay, sorry. I have Marcy and Bill Ingram came together with OSU, and this is their son. They talked about specifically how needs were not being met. And they wanted to talk about how they could bridge that gap. Originally, back in the day, it started that there wasn't any services there necessarily for adults. Sorry, I'm like getting really nervous, sorry. But anyway, so can you take over this? Yeah, I need a second. Sorry, I just get really anxious enough. The real transparency is that I wasn't supposed to do this, and like public speaking is not my thing. So I'm getting super nervous, and that's all I can hyper focus on right now. Yes. I know I was thrown this and I was like, I can talk to someone one-on-one all day, but you get me a crowd and I go into tunnel vision. All right. Yeah, let's do that. Sorry about that. Thank you. I appreciate that. All right, let me start over. Is that okay? Can we do a redo? All right. I think we'll get rid of that and I can just speak on it. Okay, so basically the barrier to the bridge of pediatric care to adult care. But beyond that, being an individual with autism, the barriers of sensory needs, the barriers of one, just having the support. Once you turn 18, a lot of that support goes away. We partnered OSU. I was not around 2014 when it started, but the Ingrams came to OSU to give a donation to start a primary care setting because their son they just found that their son and other parents were left kind of feeling empty-handed when a lot of them leaving children's to go to adult care. So they made a donation and met with our director, Chris Hanks, to start the program. A second. I got too nervous and went ahead of myself. So yeah, so going back to this, the issues with difficulty communicating, noises, crowds, the typical things that can go or cause barriers to services we wanted to address. And also just the limited availability of providers that provided services to individuals with autism and the understanding of what does that mean? What does it look like? And so that is one thing that the Ingrams came together to work with OSU to start this program. When it originally started, there was one provider, Dr. Hanks, and one RN care coordinator. We now have 11 providers. CAS has continued to grow. We've continued to grow our location. But going back to that, so beyond that, this is where I do want my notes because I want to make sure I get it right. Comorbidities with individuals with autism is often something we want to try to address. Diabetes, hypertension, obesity, GI issues. These often are, dual diagnoses that we see. Also mental health, anxiety, depression, and often individuals with autism do not attend to their care. They often do not go to preventative appointments and often utilize emergency room services a lot more. So like we talked earlier, the unexpected routine. So, the rigidness that some people do need, the unexpected in a waiting room. There's babies crying, there's a long line. So those are also barriers that individuals face. And also, autistic adults face higher rates they have more complicated medical issues than non-autistic individuals. All right, so like I said, the Ingrams did the donation, but we continue to have many other, I took you out of a job, I'm sorry, but maybe this helps me. Okay. So basically what makes CAS unique? We focus on the patient experience. So what is going to be specific to the individual? Like I said, accommodations are the big thing that I think that makes CAS different. And she's going to highlight what specifically accommodations that we try to aim for, but also finding that most of these accommodations are minimal and they really create a big impact. So one thing about CAS is that, well, how many people have switched a provider in your lifetime? Switched to a provider. That first appointment. Sometimes you feel like you've retold your story 5 times till you finally get in to meet with someone. That's one thing that we try to address. Often individuals, that we are serving, they do not want to speak about themselves, or maybe they don't have the ability to do so. So we try to do a really thorough intake process before they even arrive to the appointment. So at that point, we kind of know who's coming to the first appointment. Any accommodations that, like I said, like they would need, we address that. And the first appointment is 60 minutes because sometimes I feel like when I'm at my own primary care, 15 minutes, you got to hurry up and they're already late to the appointment. And then you feel like, did I address everything I wanted to go over? So we try to do our first appointment 60 minutes. So we go over everything. When they do their intake, they meet with Brittany, and Brittany prepares she does I'm kind of stepping on what you do, but that's okay. She does a huddle with the providers. So the providers are aware, kind of have a backstory before anybody arrives to their first appointment. She also does a consult with me. I try to attend, as the medical social worker, I try to attend all appointments. So really that is how their first appointment goes with the accommodations. And just overall, at that first appointment and every CAS appointment, we go over not just health, we go over life. So, are you working? If you're working, if you don't want to work, are you getting out in the community? Are you even wanting to get out to the community? Those are things that we highlight. Like I said, CAS does have that transition age. We recently changed the age from 25, or it was 25 to now 35. When I joined CAS 2 years ago, I was seeing that a lot of the population just missed that mark because, and that's another thing that we help with, at age 26, you often go off your parents' insurance. Or maybe your parents were kind of handling your healthcare up until that point. And individuals are like, well, where do I go? And they were already aged out of our program. So I kind of advocated for that age to be adjusted up to 35. People often ask, why do we not do all ages? It's just, we have to have the providers to do so. Like I said, we started out with 1 and now we have 11. You have to have a diagnosis of autism prior to joining the CAS program. And really, I think they provide documentation to you from their diagnosis. And so people often ask, well, can you diagnose individuals? We do not do that at CAS. That's an important thing to take away, is that you do have to have your diagnosis before attending. The thing that is a little bit different also is, like I was trying to say earlier, it's a team approach. We have a RN care coordinator, myself, and the medical staff is trained as well at your first appointment. We also do long-term care. Once you turn 35, you can be in CAS as long as you would like to be. People often think that, okay, where do I go when I turn 35? You can continue to attend CAS the rest of your life if you choose to do so. And then also the thing about our specific providers, what I was telling you earlier, the complex needs that often these individuals face, our providers are familiar with working with the complexity that could be. CAS is not the only program that does this, but it is one of the very few specifically here. And it's I think the only one here in Central Ohio, but it is rare nationwide as well. So going over what available services, obviously we have physicians who are certified to work with these individuals that have previous training of, okay, what's the best way we're going to communicate? What's the best way that I'm going to be able to provide this service and to provide the best care? We have a psychiatrist, because she is so awesome, Dr. Bird. I don't know if anybody is familiar with her. She has a full schedule. So that's a big thing that people try to gather more information from us. And I'm always disappointed to say, well, right now she's not taking patients. But we do not want people to not come to CAS because of that. So I can help people get services elsewhere. So I wanted to highlight that. We have a dedicated psychotherapist. This was a recent add-on. I'll get to that here in a bit. Like I said earlier, we have medical assistants, dedicated nurse, and a dedicated social worker. And we work very closely with other departments, dietitians, and pharmacy. I want to highlight specifically what my position is and why I think it's a little bit different from most primary care settings. Is social workers are very minimally involved. They they're the gap of, okay, you're here, you're going to go here. They bridge those services. But with CAS, it's not case management, but we do pretty thoroughly follow people and their needs. The biggest thing that I do is educate individuals on what supported decision-making means, especially in a healthcare setting. And also guardianship, and when is guardianship necessary, and when do you, and you know, what are your rights with guardianship? So we do a lot of educating on that. People, when we do intakes, are you the legal guardian? Yeah. Okay, can you provide that documentation? Well, we don't. I mean, I just take care of them. And so it's that educating individuals what the legal process of that means. And also we have patients that tell us, well, yeah, mom's my guardian. I said, well, you turned 18. Do you know what that means? And there's a lot of education of what it means when someone turns 18. I do a lot of insurance explaining. I say that question mark because even I am teaching myself what that means because that constantly changes. My expertise is I often send a lot of people to OOD because that is kind of what my background is. So we partner with them. Every county board, I think pretty much in Ohio, mostly Delaware and Franklin County, but like I was telling someone earlier, we Cuyahoga and Meigs County, am I saying that correctly? All over. And then also another thing that we do is I work very closely with Rachel. If someone is seeing her for therapy, if they need a service, like for example, they're having trouble getting to her appointment, I do transportation education, housing assistance, and also I assist with referrals like that go out to occupational therapy, physical therapy, things like that, and medication assistance, getting medication covered. With that, like I said, it's not case management, but I do social work consults. These can be at your appointment, but if time is not going to allow that, we have designated slots for social work consults. So that is a thing that I've added since joining CAST because our appointments are great, but by the time you've reached that like minute 55, you know, if the patient is even still in the room, it's a lot. So we try to break down those things. I want to apologize for my little panic attack at the beginning of this presentation, but I thought I was good and then I just started zoning out. But I will go ahead and pass it over to Brittany. She's going to tell you a little bit about what the process of what she does, and I will let her take it from there.
All right, thank you. So basically you take a look at everything, you're like, oh, I'm really interested in this. You know, I need a primary care doctor, someone who understands autism. I'm really interested in the social worker, the psychotherapist, you know, that sort of thing. And then what's next? So call in, get a referral. So you can do that by calling our number, which we'll have later, or you can self-refer online. If you Google OSU CAST, it should pop up. There's a link. You can click on that, just a little referral, and it sends straight to my email. So I typically try and get back in about 2 days with everyone. But then after that, I'll make a call. I'll go over everything again just to make sure, hey, are we on the same page? This is what you need. These are the supports that you're looking for and also what we provide. At a later time, we set up an intake where then we'll look at accommodations, what to expect at that appointment, and goals and expectations for the program. Again, communication, number one, make sure we're all on the same page for this. So within that intake, go into a lot of past medical history, current medical history, and just getting to know the patient, what we can do for them to best support them when they're here with us. A lot of times that's asking, like Christina said, very simple questions. Are there certain accommodations, certain challenges that you might have in the medical setting that we should know about just so that we can best support you when you're here with us? So definitely first talking about those accommodations. We can limit waiting room time. So if that's a barrier, like she said, the noises and everything, we have different registration processes at different locations. So we can kind of plan ahead. And if that is a challenge, then we can pre-register, and then we can also do a room immediately for that location if that's most helpful for the patient. With scheduling, we can the first appointments, like Christina said, are 60 minutes just, to get to know everybody and get all the information that we need. Moving forward, those ones are kind of like set in stone. So a lot of the CAST appointments are like at certain times of a day and a certain time of the day. But moving forward, you can kind of schedule whatever happens to be most convenient for your lifestyle and for the person. Because a lot of people, oh, I just really don't like early mornings, or oh, like, you know, it's just hard to get them going in the morning. So come for items, we say, hey, is there anything that could help you while you're here with us? You know, headphones, fidget spinners. We have some of those that we can touch on later. I think that's on a different slide.
Yeah,
as well.
We have, yeah, we'll go over those, but these are all our fidgets that we brought today that we can provide at an appointment. Maybe I need this.
So a few things that we ask about accommodation wise, lighting. So unfortunately, we cannot dim the lights or anything like that. And unfortunately, also in the healthcare, there's always all these fluorescent lights around that increase anxiety. So we do have sunglasses at our locations where we can offer those. If, you know, a patient wears a hat or has their own sunglasses, we can, you know, encourage them to bring those.
Some of our facilities also have the ability to dim the lights, which we can use and ask our medical professionals to help with. So dimming the lights is always an option.
Yeah. Is that at the New Albany location? Okay, perfect. All right. And then noise reduction, like I said, rooming immediately if that's needed to be done. You know, sometimes it's just communication, like they're okay in the waiting room for a little bit of time. You know, if that comes to be a challenge, just let us know, just communicate to us so that we can best, you know, support that person in their time of need. You know, bring your headphones. Do you like to listen to music? Is that helpful? Definitely encourage them to do that. Yeah, and then offer quiet waiting areas, calming rooms, and then remove the crinkly exam table paper. Like, people might not think about that, but that might be a huge, you know, trigger for someone or not liking that feeling, that sensory touch.
We also, there are certain situations where people, I mean, we go as far as I don't wear heels that would make noise. Sometimes we're asked not to wear certain buttons, and doctors, white coats can trigger a certain feeling. Doctors often do not wear their white coats at all. So those are also some in-person accommodations that we've made.
And then plain language, definitely. One of the questions is also like, do you prefer conversational questions? Do you prefer more direct yes or no questions? And that's very helpful for the provider to know ahead of time also, just to help best support that individual. We do have pictures and social stories on our website. It's pictures walking you through the whole office. This is what, you know, registration looks like. This is what your exam room looks like. Kind of just getting that patient that likes to prepare acclimated for that appointment if they're a visual learner and don't like change. And then alternative communication, of course, you know, if we prefer the written notes, again, just kind of getting to know their needs and how we can best accommodate that in that first medical appointment.
Yes, and oftentimes if we are able to get this certain thing, like if we can't get a blood pressure or we weren't able to examine, the doctors do a really good job at rescheduling really quickly. Like within a month, we'll try it again in a month. And if that didn't go, we'll attempt it. And they really do their best to try to make the most accurate exam, but also make the patient.
I think planning, definitely. Blood draws and vaccines, that's something we also ask on the intake. Is that a challenge? Can you tolerate that? And I know we'll talk about it later, but we do have a specific CAS lab at 2 of our locations where we can actually schedule an appointment. So it's not sprung on the patient that day for that appointment, like, hey, you need labs right now because then this anxiety triggers and you're just like, you know. So we do have the ability, and I think just telling people about that CAS lab, they feel so much better, like, oh, I know I don't have to do it right now. I can schedule that at a different time. And it's just a way better experience than to just have to think, oh, no, I have to go downstairs and get my labs right now today. So it just helps ease that anxiety.
All right. And the last accommodation that we want to highlight is the one that I'm specifically part of, which is the training of staff. I work very closely with all 4 of our locations in training and making sure staff is comfortable. Maybe I was a little naive joining because I have my background, but there were many medical staff that came to me and said, I'm uncomfortable. I don't know what, I don't want to do anything. And so it's just education and awareness. So I'm part of the staff autism awareness and training. But I also I always say parents or guardians or friends, you're the expert of the individual. You educate me on what we need to do, or the individual. If they're not able to speak for themselves, or maybe just don't even have even myself, like I still call my mom of, okay, what is a 401? What do I do? I'm still calling my mom at 39. So there are still things where we try to have the parents or guardians involved as much as possible. We also do, and I think Rachel, you did the training, we do crisis training as well, crisis prevention rather. All right. One thing I like about CAS is what I was saying earlier. If we know they're not going to get through an appointment, leave. You can leave, or if the parent wants to stay and the patient wants to exit, that's fine. We also kind of factor in the aspect of allow them to escape. We've done, what I'm getting at is we've done appointments in the car. We've went out to, Dr. Hanks and I have been out in the parking lot doing exams as well. So as Brittany highlighted, we do as much prep for appointments as possible, which we do have videos on how to show individuals how to do blood draws, check blood pressure and EKGs. Not just for the patient, but also other providers can go on there to get the other receiving end of how do you the best way to give vaccinations or to check blood pressure. They're both on the website. Also on our website, our social stories, we have all 4 location social stories, and they just recently did our labs to kind of highlight specific. I'm going to get to that in a little bit about our labs, but basically it's a step. I pulled a few of them, but it's very step by step to the moment you arrive to the building, going to registration. I mean, there's even slides in between there on our social stories that help break all of it down to help prepare. Let's talk a little bit about what makes up CAS first. These are all our providers at the different locations. We do not currently have a wait list for CAS. We're about 2 months out.
2, 3, and it kind of depends on your location, if there are any preferences as well, male or female. But 2 to 3 months right now.
And we're looking to add more providers. I think you even, Willie, I think maybe asked me, how does a provider become part of CAS? And really it's Dr. Hanks started the program, and then from there it was just kind of consulting with different providers to see if they wanted to participate in the program. It ranged from individuals who have family members that have various disabilities or barriers to, we just had 2 providers join that did not have a background working with individuals with autism. So we do a level of provider education as well. I meet with them, and you're going to hear about waivers. Providers don't know what waivers are. I don't even know waivers half the time, but we go over what a waiver is. You're going to hear that and how that's going to impact what services they are wanting to receive, or what documentation they'll need to get those services. We educate the providers on that. We also educate them on why Social Security or different other resources that are out there. So say someone is coming in and they have an issue with their current home care staff. Some providers, talk to someone else about that. We really try to educate our providers on what does that look like? What does a home life look for some individuals versus others? And then I want to highlight some of our most recent add-ons. To date, we have served 1,200 autistic patients. That is continuing to grow every day. I think Brittany does 2 to 3 intakes a day, it seems like anymore. So that is constantly growing. I talked about our lab. That's what I want to highlight, because that is a new thing that we have done at our New Albany location and most recent Hilliard. Like Brittany was saying, there's designated CAS slots that's an hour time slot that you have that whole time. You have the staff there to work with you and make you comfortable. You have a designated room where you can sit down and you can be comfortable. And like I said earlier, if that doesn't work, then we do a different day. You don't have to have a CAS spot appointment, but it is something we offer because labs can be tricky for a lot of the individuals we work with. And our most recent add-on within the last 2 years is Rachel. When I joined CAS, most of my referrals for social work were going out to we needed therapy, individuals that specialize working with individuals with autism. I was like, why don't we just have someone in staff? And I, once again, thought I was going to be told no. And they're like, actually, let's actually bring someone on. And we work very closely with the Nice Center. And that's how we got to meet Rachel. Do you want to talk a little bit about yourself or, okay.
Man, she's making me talk about myself. So yeah, I worked at the Nice Center for almost 8 years, and I really loved the aspect of my job that was counseling. And I found out through one of my colleagues at Nice that they were looking for this position, and we just talked about it and made it happen because it is exactly what I want to be doing. So I do traditional counseling that doesn't look traditional. So I just take the time to really talk to someone and figure out what are your goals? What do you need? And sometimes the answer is, well, I'm here because my mom says I need therapy. And I'm like, okay, well, let's figure that out. And we just talk through it and we figure it out. And maybe it means that for the first 4 times you see me, you're there for 15 minutes and you say, I hate this and I don't want to come back. And then it just gets a little bit longer and a little bit longer, and then we get somewhere. And sometimes it means that I'm sitting there for 45 minutes talking about Star Wars. And if that's what builds rapport, that's what builds rapport. So really, it's just taking the time to meet someone where they are and give them the individual time and care that they need. So that's really what I do every day. And then I'm not going to read the slide because you can see it. That's where I came from. That's kind of what I do. And that's all.
Yeah, she's located out of our New Albany location and our Hilliard location, and also has the option to do telehealth. We prefer in person, just so there is some level of rapport being built and that, you know, we feel that everything is effective. But there is that option as well. So it was great to have her added to the team. And she has an incredible skill and knowledge that she shared with me. I have to laugh. I'll like walk into her office and she'll have like a sticky note of some movie. And she's like, I have to research this, or some Marvel movie. And I'm just like, maybe I need to, because I have no idea what that is. So she definitely does her homework, which I really appreciate about her. A new thing that we've also added recently, or we had before, but then we wanted to bring it back, and this is overall just an OSU initiative as well, is the Patient and Family Advisory Board. We wanted to hear, if we're not serving the individual, then what really are we doing? So we wanted to have the patients. I really wish there were more patients involved in our Patient and Family Advisory Board. And we're growing, but this is, like I said, a recently new thing. But we really want to hear from the patients on how can CAS improve their experiences, but also overall, how can OSU be very transparent? The biggest thing that we do hear back is inpatient experiences. And we are trying to work with inpatient to continue to make sure quality of care is happening. And they just added a complex care. Is it actual inpatient, or they have an appointment, or
she's a nurse, critical care coordinator.
Yeah, she just inpatient
bridge.
care coordination. That's what she does. So we kind of work with them as well in case any of our patients are inpatient. So this was a great add-on. This is going to continue to grow, and just basically we want feedback and what do you want your healthcare experience to look like. So overall, why did we sit here today and talk to you about CAST? And honestly, I feel so passionate about this that it's beyond just healthcare, honestly, of what CAST is doing. But we want to have continuity of care. We want to make sure people are coming to their appointments. If they don't come to appointments, I'm not annoyingly calling you, but I am going to call you and say, hey, did we miss our transportation? What maybe sometimes provider fit isn't always appropriate, and we work with individuals to get them to the provider. Maybe they wanted a female over male. We do try to work with individuals and make sure that they are at least coming. They have to participate at least 3 years. You cannot go 3 years without a CAST appointment to be part of CAST. We've also improved just quality of care in the aspect of vaccines are being given. And I wanted to highlight a number. That's where I'm getting at. Oh, and lower emergency department rates. That's the one that I really like to see, because As you see, there is a little bit of a stat here that although you may attend CAST more for preventative appointments, overall, you will be spending less on the other resources like mental health and outpatient visits. We're getting close to time, but I want to highlight a few of our patients. James is still currently a CAST patient with Dr. Hanks. But one thing that we want feedback from the individuals. That's the whole point of, what can we do? And he really appreciates that, that we take the time to understand autism and what that means and how that's so unique to the individual. And he had mentioned that he wishes more providers were providing this service. And this is Carrie. Carrie is he is still with us at the Hilliard office, and I laugh just at that smile. But his mom definitely said that she appreciates that she feels like appointments are more productive. She feels like things are actually being done and completed, and that we can get other providers involved, such as dentistry. That is also something I did not highlight, but we try to work very closely in getting that need met as well. Let's talk about how people can refer. No referral is needed from a provider. You can self-refer. You can call in. You can complete an online referral. We didn't highlight that you do not have a wait list either for therapy services. And then Brittany does a wonderful job at following up with people in a timely manner, but also in a manner that's is going to be beneficial to them. So maybe we're utilizing my chart for that initial communication.
We do have, I forgot to mention this, a way to do a complete digital intake. If maybe talking on the phone is a barrier or challenge for some, then we have that option to do a complete intake online where they can just do that and it'll automatically send to me the results. And then I can just call to ask any follow-up questions if that's easier for the patient.
I'll wrap up now and ask as many questions as you would like. But CAS is going to continue to grow within OSU. We'd like to see other healthcare companies doing the same and providing, ultimately, I always say, I hope a program like CAS isn't always necessarily going to be needed, that, their autism awareness continues to grow. But for right now, I will hand it over to you guys for questions. And right, is that okay?
Was, does someone need to be county board eligible to receive the services, or can they just have autism?
No, no, you do not need county board services. Is life a little bit more easier with county board involvement? Yes, but no, you do not need county board services, just a diagnosis of autism. And in fact, I'm shocked by the amount of people that are not linked with county board by the time that they get with us. So we do a lot of referral to DD and what that process looks like.
Also, you all have a partnership with dentistry services.
I know, I kind of brought it up briefly there at the end. It is a huge barrier. There's a long wait list right now. We are trying to find other local dentists that will do sedation. That is a big barrier as well. But yes, we do have a partnership with OSU Dentistry. We're hoping to expand on that. That's like at the top of the list of what we're working on. But there's a long wait list. I'm not gonna lie. Yeah.
And I have one last question.
Yeah.
By any chance, do you have any affiliations or any partnerships or places to refer? Do you have people from other counties who call you all for resources in their county who may have something similar?
Yeah. Yeah. And my first go-to, they come to me and then I honestly go to the county board of whatever county first and go there. We do serve all over. But yeah, we do have consults with different, we just had someone call the other day. Where are they from?
Racine, Ohio, but I don't know what county.
Racine? Yeah, I don't know where that is either. But yeah, we do consults and then we work with the county, if not county board, mental health facility to educate them as well. But also, like I was telling you at the beginning, I had someone from Boston want to come to the CAS program. It's probably not appropriate for your primary care doctor to be several states away. But we do try to serve all of Ohio if possible. I think we do have a few people that live down in West Virginia that come up, but we try to keep it localized. I have more of knowledge of what's going on in Central Ohio, but I go to, honestly, the county board is my first go-to for some of those counties, and vice versa. They contact us.
So you had said that right now, if somebody can't get in service through CAS, they'll find somebody. I more conversations right now with violence in trying to find somebody that is familiar with working with autism. It's a struggle. I cannot.
Yeah, Rachel and I were just talking about this yesterday because I was looking for a social story about an OBGYN appointment. That is a very unknown, we're starting to work with, do you have any input on that?
Yeah, we do have a couple providers within the OSU system, and I can't remember them off the top of my head, but we do have a couple. So if someone were to need that service, you can always call us and ask, hey, do you have any recommendations? And our providers do have a couple recommendations that we could send you in different directions to look. But that also doesn't guarantee that you'll get into them. So unfortunately, we know that it's a problem, and we're trying to expand on that, but it is a challenge for sure.
And we try to work with, I go to our physicians and ask them for their opinions on not just OBGYN, but maybe a physical therapist, OT, neurology, things like that. So we try to work with other providers who are also familiar with autism.
And just like the preventative screenings, a lot of the doctors like pelvic exams or PAPs. So a lot of the providers in the CAS program can go ahead and do that preventative screening. If, however, there's something that needs to be like, more in depth or looked at that needs to be a referral, then that would obviously be the next step. So. Mhm.
We do telehealth appointments. That's a great question. We did one recent establishment.
Yeah,
You want to?
I can kind of speak on that. So very individualized, and then I have to, get the situation, speak with the provider and see, because it's also how beneficial is that telehealth appointment going to be, of course, and like what are the needs. So we did just do a CAS new appointment that was completely telehealth. The point of that one was to try and like build rapport so that we can eventually, move into the office setting. Of course, that wasn't a barrier to getting in the car. It was more just like not liking medical professionals. But I think that all the providers do typically try and work very hard to set up a plan and see, we can do this for so long, but then at what point do we reach, a wall where we have to might start thinking of some other options? But
Yeah, like I mentioned earlier, every 3 years, we try to at least get one in-person actual physical exam. Also, because we also have to stay current with, like, if someone has home care staff, that has to be within the last year actually is it 90 days? I don't even really know off the top of my head, but yeah, we can just, we'll potentially have to do an in-person appointment.
If a person with, the OH autism, that mean they're automatically with CAS or that's separate?
So let me make sure I understood your question. Because you receive services through OSU and have autism, are you part of CAS? That's a great question. No, you would have to go through the process. We do serve that age. Is that is this just like a sample? 19? Yeah. So as long as you're within that age, you can join CAS. We have people switch providers. But no, you're not automatically part of the CAS program. You would need the formal process of going through the intake and then getting assigned to our specific providers.
Like an hour away, that's provisions that they would have to
Yeah, CAS isn't for everybody. That's and just because you have autism does not mean you should be in the CAS program. really the idea of CAS is for individuals that just feel like they're facing, every time I go to my doctor, I feel like I'm getting the runaround, they don't understand. Some people are kicked out of their previous providers due to behaviors, or just really overall, if we get referrals from children's and people are like, I love my primary care doctor, I don't want to switch, then don't. Stay where you are. And that's awesome that you have a provider that is understanding and works with you, but not everybody has that experience. So, but no, those were two. Thank you for pointing that out. But like I said, if we got to factor in drive time, because they are going to be coming to several appointments. But also for individuals that do live far away, I try to work with a local office. As long as they're coming for their physical annually with CAS, they can have some local services as well. Maybe they're seeing a physical therapist locally. It doesn't have to all be centralized with OSU.
Question back here about if there's any governments or programs or development, say like University Hospital or
Cincinnati, we're definitely working with Cincinnati. The one that we're partnering with right now is in Boston. The lovely lady Jessie, who's our program coordinator, who I'm sitting in for today, she's actually would be the best one to speak on that. She's working with the partnership. Specifically here in Ohio, Cincinnati, but right now it's Cincinnati and Boston are the two that we're working with. Yeah, go ahead. Mm-hmm. Mm-hmm.
So that's a real time for them to change.
So we do up to 6 months before the age of 18, I think is the cutoff that we have, that we would start establishing, doing an intake. I think, Brittany, you could even do intakes before the person, say the person's 17, but their appointment, they'll be 18, then we do that as well.
We also try to work really closely with the transition clinic at Children's to coordinate what's the best timing for all of that stuff, because it is a very scary move and they are aware of that, and they try to push people into contacting us sooner rather than later, just so that we have that extra time to sort of start the transition before you have to.
Yeah, I mean, we go off of what OSU, you can speak on that.
Yeah, we accept Medicaid, Medicare, and most commercial health insurances. You can just look up anything that OSU accepts is what we will accept. I am the only exception to that. I do not take Cigna, but everything else that OSU accepts, we will cover.
OSU recently had a change. It does change depending on, like, say you have a specific anthem. But even then, we don't just drop people. We can't see them, but we do try to get people connected to other providers too, if anything would change. A primary care doctor, your designated primary care doctor has to be within CAS, but we do partner with, say you have more of a complex team, we work with other providers. I do know, and maybe I shouldn't speak on this, that in some situations, if someone does live down in Southern Ohio, they maybe go to their clinic there sometimes for, like, say they get sick and they just need, to be seen. They go there, but for their actual annual physical, they're coming up to CAS. We try to. I wish I heard that more often, but no, we do try to connect and work with a lot of even not just providers, but the biggest barrier a lot of our individuals face socially is the options for socialization as an adult is limited. So I'm often working with anybody that can give me feedback on what are social opportunities for individuals. beyond just, you know, that recently, I don't know if you guys, Columbus on the Spectrum, I haven't went to any of the social events, but, you know, I try to pull as many resources and if anybody says anything. So sometimes, but that is a good idea that we make sure we're listening to patients when they do say they are receiving that, but unfortunately, that's not always the case. All right, well, thank you guys so much. I appreciate it.